Hello everyone, welcome to another video. So in today's video we'll be talking about esophageal cancer. So it's still part of our series about different types of cancers. We've treated lung cancer, we treated cervix cancer. So now we're treating esophageal cancer, and this is a type of cancer that begins in the esophagus. And the esophagus is the muscular tube that connects the throat, that is the pharynx, to the stomach, and it helps move swallowed food and liquids from the mouth to the stomach. So this cancer, it occurs when cells in the lining of the esophagus grow out of control and form a tumor. So the esophageal cancer can grow into the wall of the esophagus and spread to nearby lymph nodes or distant organs if is not detected early. So this esophageal cancer, it's more common in men than women, and it often develops in people aged 50 years and above. So it has two main types, and the two most common types, we have squamous cell carcinoma, which begins in the flat cells lining the upper and the middle part of the esophagus, and is more common in smokers and people who consume a lot of alcohol. Then we have adenocarcinoma, and it starts in the glandular cells usually found in the lower part of the esophagus, often linked to long-term acid reflux or a condition called Barrett's esophagus. So what exactly causes esophageal cancer? So this esophageal cancer, it does not have one single cause. It develops over time from repeated irritation or damage to the lining of the esophagus. So the major risk factors include smoking, heavy alcohol consumption, chronic acid reflux, also known as gastroesophageal reflux disease, where the stomach acid frequently flows backward into the esophagus. Then we also have Barrett's esophagus, which is a condition where there is long-term acid reflux causing the esophageal lining to change, increasing cancer risk. So obesity too is a risk factor, which increases the likelihood of getting this gastroesophageal reflux and the likelihood of getting the adenocarcinoma, which is a type of the esophageal cancer. Then having a diet low in fruits and vegetables is also a risk factor. Then drinking very hot liquids regularly, very hot liquids that can irritate the esophagus. And then having a previous injury or surgery done to the esophagus, and also having this HPV that we talked about in cervical cancer, which is human papillomavirus. So having this infection is usually linked to squamous cell carcinoma. So basically the esophagus is about 25 centimeters long and is part of the digestive system. So it lies behind the windpipe and in front of the spine, passing through the chest into the abdomen, where it joins to the stomach. So it has several layers. It has the mucosa, which is the inner lining. It has the submucosa, which is the layer containing blood vessels and nerves. Then it has the muscle layers, which contract to push food downward. Then it also has the outer layer, which is called the adventitia. So the esophageal cancer, it often starts in the mucosal layer, that is the inner lining, and it can grow outward, invading deeper layers and nearby organs such as the trachea, the lungs, the lymph nodes. So how exactly does this esophageal cancer develop? So basically, chronic irritation from substances like acid, smoke, or alcohol, like excessive alcohol, it damages the esophageal cells, and genetic mutations occur in the cell's DNA, causing them to lose control of normal growth and repair. So abnormal cell growth leads to a tumor that may block the passage of food or invade nearby tissues, or it may spread to distant parts of the body, such as the liver, the lungs, or the bones. So for the symptoms, early stage esophageal cancer often does not cause symptoms. Same with every other cancer. Like we also talked about this in lung, when we were treating lung cancer, that in the early stages it doesn't usually have clear symptoms. So basically, as the tumor grows, the symptoms will start to show, and they may include difficulty swallowing, which is called dysphagia, especially with solid foods, then pain or burning sensation when swallowing, then unintentional weight loss, chest pain or having chest pressure, hoarseness of someone's voice, or having a chronic cough, then vomiting and bleeding, which is seen as black stools or vomiting blood, then feeling like food is stuck in the throat or stuck in the chest. So you can have this kind of sensations when the tumor is growing. So for the diagnosis, to confirm esophageal cancer, the doctor can use the following. For example, first, getting the medical history and the physical exam, so evaluating the patient's symptoms and looking at the risk factors and everything. Then there's something called upper endoscopy, which is a flexible camera, like a flexible camera tube that is inserted through the mouth to view the esophagus and take tissue samples. That is a biopsy. Then this biopsy confirms the presence of cancer cells. Then imaging tests can be done to, like barium swallow x-ray, whereby a patient swallows a special dye to highlight the esophagus on the x-ray. Then CT scans or MRI scans to check how far the cancer has spread, if it has spread to other parts of the body. Then PET scan, which is known as positron emission tomography. So it's a scan that helps to detect cancer spread, like cancer that has spread to distant areas. Then the stage of esophageal cancer is based on the size of the tumor, the involvement of lymph nodes, and whether it has spread to other organs. So for the treatment depends on the type, the size, and the location of the tumor, as well as the patient's general health. So surgery is one of them, and it involves the removal of the cancerous part of the esophagus, which is called an esophagectomy. Then it may be combined with stomach reconstruction too. Then we have radiation therapy, whereby high energy rays are used to kill the cancer cells, and sometimes it's used before, or it can be used after surgery. Then we also have chemotherapy, which is the use of medicines to kill cancer cells or to stop them from dividing, and these are usually combined with radiation therapy too. Then targeted therapy, like drugs that target the specific genetic changes or proteins in the cancer cells, and immunotherapy to boost the immune system to recognize and attack the cancer cells, and it's usually used in advanced or resistant cancers. Then palliative treatment, when we just try to improve the patient's symptoms, like improve swallowing or relieve pain when cancer cannot be removed. So it may involve stents. These are like tubes to keep the esophagus open, and it may involve using feeding tubes and also like just general supportive care. So for the management of esophageal cancer, involves giving the patient nutritional support, because patients may struggle to eat. So high calorie liquid meals or feeding tubes may be needed in their cases. And we can also look at symptomatic control, like managing the pain, giving pain medications, giving antiemetic medications to help with the nausea and the reflux. Emotional support, which is like addressing depression and anxiety or fear that the patient might be having. Then regular monitoring to check for if there's recurrence of side effects due to the treatment. So in summary, esophageal cancer is a serious and often aggressive disease of the food pipe known as the esophagus, and it can be caused by long-term smoking, excessive alcohol use, and acid reflux or obesity. And it usually presents with difficulty swallowing, weight loss, and diagnosis is made through imaging, endoscopy, and biopsy. Treatment may involve surgery, chemotherapy, radiation, just like every other cancer, and newer therapies like immunotherapy. So that is basically the whole summary of this condition known as esophageal cancer. Thank you for watching. I'll see you in the next video. Bye.